Hi everybody, we're here in week 8 of lockdown. It's Monday, the 18th of May. I wanted to give you an update as to where things are at. Obviously time is passing and we need to start to think about what the future might hold. But first and foremost, I hope you're well. I hope it goes without saying that on behalf of all the team, we can't wait to see you again. We're really looking forward to getting the doors back open and starting to see people face to face when the time is right. And we completely understand the frustration and the anxiety that patients are feeling at the moment when they can't get in to see us and that they're worried about how their treatment is progressing. And we thank you sincerely for your patience and understanding. And actually, you've all been amazing. And we've had lots of contact through our video consultations and our video reviews. And thank you so much for the kindness you've shown to our team. It truly is life-affirming to see everybody working together. I know a lot of you have taken advantage of the digital reviews and the online shop to get hold of supplies, but also to check in with us so that we can make sure things are progressing safely and to offer you some advice and some reassurance. If you haven't had a digital review, please get in touch through the usual methods. But what's going to happen next? Well, I'll be honest, it's still quite uncertain. We still don't have that central guidance that we're waiting for. And there is still obviously significant concern about the progression of COVID-19. And at the moment, we're really just waiting. We're waiting for the right time when the guidance is there so that we know that it's safe, because that is the most important thing, that we keep you, our patients, safe, that we keep our team safe, and then, of course, all the people that we come into contact with, our families and our communities and our loved ones. There's a couple of things that I do know about when we reopen, though, and the first of those is it's going to look and feel really quite different. So the patient journey, that kind of pathway from the car park through into the surgery, it's going to feel quite different, maybe even a little bit strange to start with, as we make steps and make changes to keep people safe. One of the biggest things is the significant reduction in the number of people we're going to be seeing on site. And as our operating procedures are firmed up, we're going to be giving some more advice and some more guidance as to how that's going to work. The other area that we think is really very likely is that we will be doing a phased reopening. And the first of those phases will only start once we know it's as safe as it can possibly be. And it is likely in that first phase, which might last a day or a week or a month, we just don't know, we will be doing relatively limited treatments according to what the central guidance allows us to do. So I don't think at this stage we can say that it's going to be doors open, everybody turns up on day one and off we go. I think it's going to be much more phased than that, and we need to all prepare ourselves for that. I can reassure you that we're working incredibly hard to make sure everybody gets the right treatment just as soon as they possibly can. And we are doing lots and lots of things behind the scenes, and I want to share a couple of those with you now. And the first of those is we're continuing to develop the online platforms that we're working with to continue to move more of our activity online. That's the digital reviews, our consultations, our retainer checks, lots and lots of other things to try and reduce the need to come into the practice. It's massively convenient, of course, but also it helps to reduce some of that risk and actually some of the anxiety, some of the worry that people might feel. The big news, of course, is what's happening with PPE. We are researching, we're investing, we're already acquiring stocks of PPE that are going to allow us to do the work that we need to do. We are following the highest available standards as we understand them at the moment. And as I've mentioned before, we're reinventing our patient flow and updating our protocols to make sure that we're doing all we can to keep people safe. That includes screening our staff, taking daily checks, as you would hope and as you would expect. We're looking after the staff. I hope we're looking after them well. You have to ask them, but we're spending lots of time providing some welfare support. And of course, this is Mental Health Awareness Week, and I can't emphasize how important that is at the moment for all of us to keep in contact with people from a safe distance, but also to engage with people online and to keep ourselves talking and to understand that we're not alone. The other big change is the online consultations, and we're continuing to do those both for our NHS and for our private patients, and they seem to be really well received and we're enjoying those. If you want to find out more, just visit us online at www.queenswayorthodontics.co.uk. And finally, well, keep in touch, keep up to date with what's happening. You can follow us on Instagram, you can follow us on Facebook, and once again, thank you so much for your patience and for your understanding. and for recognising that we are in it together. We can only do this with you, and we hugely appreciate the work that you're doing with us to help us have good conversations and good engagement when we do have those calls with you. But keep in touch, stay strong, stay safe. From all of us at Queensway Orthodontics, sending all our love to you, our patients. I'll be in touch soon. Thanks so much.